Hello, my name is Hannah Kleiner. Today I'm going to talk to you about promoting the mandatory use of the North Carolina Controlled Substance Reporting System. As you may know, our town of Wilmington, North Carolina is facing a horrible opioid epidemic as we speak. In fact, it has been rated #1 worst city for opioid abuse in the whole United States of America. In 2016, there were 51 overdose calls to police, with 18 of those resulting in fatalities. These numbers have increased greatly in the last couple years, with just 6 in 2015 and only 3 in 2014. There has been a 73% spike in opioid fatalities since 2005. Over here, you'll see a graph of fatalities including fentanyl. Fentanyl is a new powerful drug that people are mixing with their heroin to make it stronger. Fentanyl is 30 to 100 times stronger than morphine and is making the fatalities skyrocket. Now, one of the main problems that is contributing to the opioid epidemic is the overprescribing of opioid drugs by our physicians. Over 80% of opioid users start using after an injury or accident in which they were prescribed powerful painkillers. 53.8% of opioid prescriptions in Wilmington, North Carolina are being abused. In North Carolina, it is estimated that there are 96 to 143 opioid prescriptions per just 100 people. This is because doctors are prescribing too much of painkillers for problems that don't need this much or maybe don't even need painkillers at all. Some of the healthcare professionals that I interviewed all had stories about prescribers prescribing painkillers such as oxycodone if someone had food poisoning, in which they shouldn't even need painkillers at all, or a dentist prescribing 90 hydrocodone with 5 refills just for a tooth getting drilled. Another phenomenon we are seeing is doctor shopping. Doctor shopping is when patients are seeing multiple providers for the same treatment. This is often used to procure prescription drugs illegally. In North Carolina, the average doctor shopper uses cash so there is no paper trail and it's easier to fly under the radar. They are between 20 and 40 years old and can see about 10 physicians a year, all for the same prescription, and they can get up to 32 prescriptions a year. North Carolina has a reporting system called the North Carolina Controlled Substance Reporting System. On there, a physician or anybody who prescribes medication can register, and then once they are registered, they can find any patient and find all their past prescriptions, their recent past prescriptions. When they sign on, they would see the name. See here we have John Smith, and we would have the medication and the amount that they got, whether it's a new or refill prescription, how many refills the doctor gave them, which pharmacy they got it at. As you can see here, a doctor shopper in particular would see multiple pharmacies as well as multiple prescribers. And over here is the date that they got the prescription. Now this would help doctors because they can see if the patient is getting obviously too much of a certain kind of medication, and it can show a patient's habit if they are seeing multiple doctors and multiple pharmacies. And this would help the provider decide if they really wanted to prescribe the medication. Unfortunately, in North Carolina, only 1 in 5 prescribers are registered for this system, and out of those that are registered, only about half use it on a regular basis. Now, I'm proposing that we make this a mandatory step in prescribing. Every time that a physician needs to prescribe an opioid medication or any powerful painkiller, they should check this. It should be required that they check this site to see if the patient is a prescription abuser, and if so, then they can offer them some help. In 2012, Kentucky passed a similar law and they saw great results. Just in the first year, they saw the prescriptions for Vicodin go down 13%. For Percocet and Ultram, it went down 12%. And for Opana, which is also called oxymorphone, it went down 36%, which is huge. Now, overdose hospitalizations dropped 26%, and prescription opioid deaths dropped 25%. And even with these great statistics that they're seeing, there are no laws in North Carolina that require a prescriber to check this system before prescribing any medications, even though we've seen that it has great results. To help monitor the system, to make sure that there's no prescriptions going under the cracks because the provider is busy, I propose that the system itself generates a random code for every single opioid prescription being made. And this code is needed along with the prescription in order to get it filled at all. And that way, there's no way that a prescriber cannot check this site and make sure that their patient is not abusing this medication. And here it says that research found that prescription monitoring databases can save up to 10 deaths related to abuse every single day. And to me, it's worth the extra 2 to 5 minutes it may take to look at this database every single time that a patient comes in for opioids. Now, my conclusions and recommendations is that we need to require all physicians and all pharmacists to first and foremost register for this program. We also need to mandate that they check this program, this system, every single time that they're going to write a prescription. And like I said before, we should develop a facet on the system that generates a code that is needed every time a prescription for opioids is made. That way it becomes just another step in the process of getting a prescription from the doctor to the patient. It is time that the public makes it clear that we are fed up with the opioid abuse and fatalities, and that our doctors need to be careful about who and when they are prescribing these medications to. I hope that this was informative today, and thank you for listening.